Do you have shin splints, like a sharp pain right here on the front of your shin bone? Are you worried that it might be a stress fracture or something worse? In my experience, the vast majority of shin splints are muscle and tendon related, but let's do a quick test so you can get a better idea of what you're dealing with. If you actually have a stress fracture, like a micro break in your shin bone, in your tibia, very often the pain will be localized, meaning you could point to it with one finger. And the most important feature of a stress fracture is the pain is often very constant throughout the day. With muscle and tendon issues, which seem to be much more common when it comes to shin splints, the pain is often yo-yoing. It might be worse in the morning, and it's often worse when you start running. But after you run for a little bit, with the circulation and the heat, the pain might go down. It might even go away completely, but then it comes back later. The pain is also more generalized, so instead of one finger, it's often 2, 3, maybe even 4 fingers in terms of where you feel it. But that yo-yo pattern of coming and going, worse, better, this is very indicative of a muscle tendon issue. When it comes to shin splints, the vast majority of the time, it's a pretty minor condition. Within 2 to 6 weeks, you can usually get over it. The biggest risk of getting shin splints is actually losing momentum with your new fitness routine. That is often what caused the shin splints in the first place. My hope is that we can help you heal this really quickly, get you back on the road, back to doing what you love quickly. Hey, my name is Lucas. I am a yoga teacher. Nobody gets shin splints in yoga room, but people come to yoga when they're taking a break from the road to heal from shin splints. I've had shin splints myself too, 3 different times in the past. Hopefully what I've learned can be helpful for you. In this video, we'll talk about the anatomy of shin splints. We'll talk about why they happen. Most importantly, we'll talk about how to heal them. Quick disclaimer, I'm not a medical doctor. If you suspect that you have a stress fracture, osteoporosis, nerve condition, please err on the side of caution. This is for educational purposes only. Go see a doctor. If you'd like to skip forward to the exercises, I always put a PDF link down below where you can see everything. Let's start off talking about the anatomy of your shin and shin splints. Your shin bone is actually your tibia. We have 2 bones of our lower leg, and your tibia is this one in the front that we refer to as your shin. And the medical name for shin splints is medial, so the inside, tibial, your tibia, stress syndrome. Medial tibial stress syndrome. And this is a general term to refer to all of these conditions. Could it be a stress fracture? Possibly, probably not. Could it be the lining around your bone, which some people theorize? It's called your periosteum. Possibly. Could it be the muscles and or tendons that attach or pass near the shin? Very likely, and this is where we'll put our focus today. Now, your lower leg is surprisingly complex. Some people might say there's 20 or even more muscles. A bunch of them are really small. But the big culprits here, the usual suspects, are your anterior tibialis and its tendon, which attaches at the shin bone, posterior tibialis, and then also your patellar tendon, which comes down on the top. Probably less likely. Very often, it's that anterior or posterior tib, but it could potentially be any or multiple muscles and or tendons in your lower leg. Here's the thing that you need to understand. Shin splints, there are 2 factors that are almost always at play when somebody gets shin splints. The first one is running or jumping of some kind, and the second one is something new. It could be a new exercise routine, it could be a new pair of shoes, it could be a new distance, it could be a new level of intensity, it could be that you were running on a treadmill and then you went to pavement, or you were on pavement and then you went to a track. Something changed. It's usually running and jumping and then something new. Here's what happens when you do something new. Your muscles, they respond very quickly to stimuli. That doesn't mean that you can bulk up like a bodybuilder overnight, but it does mean that very small, very functional adaptive changes can happen to the musculature of your lower leg literally within a couple of weeks. If you start a new running or jumping or plyometrics routine, 3 weeks into it, 6 weeks into it, your legs, from a muscle standpoint, can really be a lot stronger. You can really feel that power. However, your tendons and your ligaments and cartilage, those connective tissues, they take a lot longer to catch up. Why? They're poorly vascularized, sometimes they're avascular. They don't have a really great circulation. They're slower moving, they're also stronger. That's the benefit. The downside is they take longer to adapt. So your muscles might be ready to roll in 3 to 6 weeks, but your tendons, they might take 3 months, 6 months. Very common that this is why shin splints will kick in when you're into a new routine. So then the question is, if we have a tendon that's inflamed, tendinitis, if we have a muscle that's overworked or damaged, a muscle strain, what can we do to fix it? As soon as you go online, you'll find a whole bunch of information that's focused on pain relief. Pain relief is not healing. This is really important. If you put your shins on ice, will the pain go away? Yes, but you'll also reduce the circulation. Bad idea. If you use compression socks or compression sleeve, will the pain go away? It'll at least go down, but again, that's going to reduce circulation. Same thing with elevation. Ibuprofen, this is going to block inflammation. That's a healing response. Almost all of these things that remove pain don't have anything to do with healing in the best case. In the worst case, they'll actually slow down your healing process. With shin splints, pain relief is a really bad approach because the pain's not that bad to begin with, usually just when you're doing your exercise. The one piece of popular advice that you'll find which is appropriate is rest. But I would swap out rest and I would just say slow down. Remember we talked about before these two components that are usually present with shin splints. One is running or jumping, and the second is something new. What if I said instead of resting, just slow down, and instead of something new, do whatever was old? Switch back to your old pair of running shoes. Switch back to your treadmill instead of the blacktop. Switch back to your walking instead of your running. Whatever it is that you introduced that was new, what if during this healing period, let's call it 2 to 8 weeks, you revert back to slower and doing what you were doing before? This can be a very, very simple way to heal. The other thing that you'll find people is trying to fix shin splints. They're taking spoons and digging them into their tissues. They're using theraguns and percussive therapy devices to blast those tissues. They're using elbows and manual therapy. They're using deep stretches multiple times throughout the day. When muscles are damaged, when tendons are inflamed, they don't respond well to this type of treatment. They're simply going to get worse. Your condition should get better to get better. Inflamed and bruising yourself with aggressive therapies, that's simply going to exacerbate the condition. Muscles heal relatively quickly. These tendons are going to take some time. And while they're healing, they do need to be mobilized and they do need some gentle load, some gentle stress. The best way to approach this from a corrective exercise perspective, especially during the first couple of weeks, is with isometric holds. So we'll take our muscles into their full range of motion, and then we'll load them very gently and hold it. So the movement is really limited and the tendons are loaded in a very controlled way. And then eventually as time goes on, you can get back to the activities that you love. Just remember that your connective tissues need time to get caught up to your muscle tissues. Let's take a look at some exercises you can do at home. I'd like to show you some unusual exercises you can do, some corrective exercises to help to accelerate that healing process for muscle and tendon issues that are causing your shin splints. If you have a mobility, a stretching routine that works for you, as long as it's light stretching, go for it. If you have a self-massage technique, as long as it's light massage, go for it. Just remember, we don't want to do hardcore deep stretching, and we don't want to use percussive therapy or really aggressive manual therapy. Keep it really light. These practices I'll share with you right now are designed to load the muscles of our lower leg. And when those muscles are loaded in a contracted state, it also helps to gently load and stress the tendons, specifically our anterior tibialis, posterior tibialis, soleus, and gastroc. Some of the other smaller players too, but we'll focus on the big ones. Just remember, your back leg should be straight and strong, but with a very moderate intensity, 4 out of 5 intensity at the very most. And I'll keep a chair in front of me just in case you need for balance. We'll do 20 seconds on each leg, and then we'll switch to the second version. I'll walk you through it right now. So I'll stand with my feet about as wide as my hips. I'll lean forward, I'll hinge forward and place my hands for balance. I'll lunge my right leg back, but not very far. It's about 2 feet behind me. And from here, I'll find my balance by kicking back and straightening my leg completely. I'd like you to feel 4 out of 5 intensity. My heel is lifted, and I'm in a very gentle, what I'll call a Dorsi lunge. And if you're comfortable, lift your arms like an airplane, gaze forward, and again, kick back into the heel. If you're feeling wobbly, or if you're feeling unstable in that knee, you place your fingertips or your hands, no problem there for support. Kick back through your heel, your back leg should be engaged. If you feel a little bit of trembling in the back leg, that's okay. We're at 20 seconds. Just don't overdo it. Let's release and shake it out. Switch legs, I'll hinge forward, place my hands down, step my left leg back a small step, and again, kick back through that heel. You should feel both a stretch and a gentle loading of your lower leg here on the back. I'll start my timer and I'll lift my heart slowly. If you can, airplane your arms, straighten your back leg completely. Breathe in and out through your nose here. If it's too much on your front leg, if you're feeling unstable, you could fingertips or place your hands, but if you're okay, come up to the balance, breathe here. Good. Put your hands down, step your leg back, and shake it out. Now the next version, plantar lunge. We'll do the same thing, but with our toe pointed. The balance is a little funny here, so don't be afraid to use the chair. Hinge at your hips, Place your hands down, step your right leg back, but this time point your toes. You're on the top of your foot. And again, take a smaller stance if you need to. Gently come up, and again, you'll feel a little bit wobbly here. As soon as you can, straighten your back leg all the way. Press down into the top of your back foot. Lengthen through your spine. Gaze forward, breathe through your nose. Good. Place your hands down, step back, switch legs, shake it out. Left leg back, plantar flexion in my back ankle. I'll point my toes, pause here. Remember, you can absolutely, timer's going, practice with your hands on top of the stool. But if you feel comfortable, you might lift up. Just make sure you're getting 4 out of 5 intensity on that back leg. That's the most important thing. If it doesn't happen, sometimes you might find that by leaning forward, you can actually get a better load on that back leg. Good. Place your hands down, step back, and shake it out. Essentially what we're working on here is dorsiflexion of our ankle, plantar flexion of our ankle under load. Use the stool or the chair, or don't. If you just do those 4 rounds a couple of times per day, that can really help to encourage the healing process. I hope you found that video helpful. Remember what we talked about firstly is, number 1, slow down. And number 2, go back to whatever you were doing before the new thing came in. So if you were on a treadmill and you went to the road, go back to the treadmill. If you switched shoes, go back to your old shoes, at least during this period of healing for 2, 6, 8 weeks at the most. Try out this Dorsi and Plantar lunge, see if they help. And again, if you have some simple mobilization exercises that are helpful for you, do them. Just remember that you need to give your connective tissues time to get caught up to your muscles. If you've enjoyed this video, click subscribe down below. I release science-based yoga and injury videos once a week. If you would like to find my teaching calendar, it's at YOGABODY.com. I have online and offline courses around the world. And lastly, if you have questions or suggestions for future videos, love to hear from you down in the comments below. Thanks so much, and we'll see you in the next video.